the next presentation is by Dr. Sapnil Kothari, and he would be speaking on precision toric, novel AI-based indigenous cost-effective toric guidance system follow-up study.
Good morning. Myself, Dr. Swapnil Kothari. I'm the presenting author. So this is about precision toric. We have a financial disclosure. Authors 1 to 4 are directors, and author 2 has no financial incentive. As we know, 25 to 30% patients have a corneal astigmatism more than 0.75, and our options are either toric or LRIs or OCCIs in some cases. Now the problem with toric IOLs is manual markings have a spread and fade, accuracy is a little less, and they are cumbersome to do, while automated devices are significantly costly and fixed to one microscope. So we ourselves invented a toric guidance system, which is precision toric. It's an indigenously developed and extremely affordable system. We using the off-the-shelf components and uses advanced self-learning to guide you during your surgery. The aim of this study, as it is a follow-up study, was to validate the accuracy of precision toric in live patients, and it was a non-randomized dual-center non-blind study. We had 49 eyes of 36 patients, out of which 19 were males and 15 were females. The age group was 46 to 76 with a mean of 62, and we chose only non-complex cataracts with a reliable preoperative topography to be included for this study. The method of using precision toric is you can do a random ink mark at any location, and then a baseline photograph of the patient is taken with the precision toric software, which is an Android software. Here the head tilt has to be kept a minimum. I would like to address Dr. Bhidesa. This question was raised to us during our previous study, and we did study the effect of that. So the head tilt has to be kept to the minimum, and the photo is uploaded to the server over Wi-Fi, and the baseline photo is processed by our software, which is a computer-based software, and in which you have to basically input the toric IOL location and the incision location, and then it processes that image, reverse calculates everything from the ink mark, and gives you a live guidance. I have a video, but due to time constraints, I am not showing it here. And then the software processes everything, and it gives you the live guidance of where your ink mark is and where you are supposed to place your IOL. Coming to the results of the study, all eyes, the limbal and ink mark location was satisfactorily depicted, found out by the software, and ink mark augmentation was required in 2 eyes. Coming to post-op IOL position, we found a mean of 3.2 degrees, that is 1.125 degrees from where the post-operative slit lamp measurements were done, and the average post-op refraction at 30 days was within 0 diopters to 0.5 diopters of cylinder for all of these patients, with a spread from 0 to 2 cylinder. This 2 cylinder was in a patient who had a 12 diopters astigmatism, and the IOL actually could not be made available. So coming to the limitations of our study, it's a small sample size, and the slit lamp method to check the post-operative position of the IOL is actually not very optimal. Eye trace provides a better accuracy, but we don't have access to it. Coming to the conclusion of our study, we would like to conclude that our system provides a reliable, accurate, and easy and cost-effective method for toric IOL positioning, which can be utilized, and it requires further evaluation for guidance in a larger sample size. Since I have time, I'll just try and show a video. So basically the system tracks the ink mark. It tracks the ink mark, and it gives you a live guidance when you're operating of where your toric IOL is supposed to be placed. Thank you.
So could you please re-explain the how AI is functioning here?
The AI is used to find out where the limbus is. We have trained it on a large data set, so it finds out where the limbus is, irrespective of whether you have a pterygium, you have a corneal scar, and it also is used to track the ink mark in real time. So basically what we are doing is we're taking the baseline photo. From the baseline photo, we are finding out where your ink mark is. Then this again finding out is being done by AI. So the AI is tracking the ink mark, the AI is tracking the limbus, and from both of these, it is recursively giving all the calculations. The calculations are mathematics, and it doesn't require any AI. but tracking the limbus and tracking the ink mark in real time requires an AI.
So you mean this is more like a Varion or a Callisto, but with the help of a smartphone?
Not a smartphone. Smartphone is utilized for giving you the baseline image. So for Varion or Callisto, you require either the Varion base unit, or for Callisto, you require a IL Master 700. For our software, all you require is an Android phone. So the Android phone will give you the baseline image, since you have to know the location of the ink mark pre-operatively for you to track the ink mark intra-operatively. So we are using a smartphone which is very widely available, just cost you 15,000-20,000 rupees. And later on, when you are operating, the whole thing is done by the AI. So that requires a dedicated computer with high-end graphics cards. You have two ways of tackling the problem. Either you can brute force it through AI. So AI is actually a brute force method, or you can have dedicated hardware to track the limbal vessels and the iris anatomy. The problem with that is that requires a very high level of hardware integration, which increases the cost to what Varion or Callisto are charging.
Okay.
So to decrease the cost to something which can be utilized in any operation theater, we have gone with the AI method.
Good innovation.
What is the sample size you worked for?
When we submitted this paper, the sample size was around 49 eyes. Right now we are at around 87-90 eyes, and the data is consistent.
And what is your precision level? What is the residual astigmatism you've seen?
0.5 to 5, 0 to 0.5 cylinders post-operatively.
The calculations have been done on?
All the calculations are as per your routine calculator. We don't have any calculator that we have developed because it's available anyway for free on Barrett's or Kane. So you can use any topographer that you have and which you are comfortable with. You can use any calculation method that you are already have or you are comfortable with. There's no point in us developing this thing which has been already done by someone else and available for free.
Thank you
Okay,
very much.
thank you,
Time
thank
is
you.
over, ma'am. Thank you.
Thank you, sir.